Well, now I want to talk to you about the most important part of asthma, allergy and lung condition treatment, which is taking the medications the correct way. First of all, just to give you some basic information, asthma is a disease in which the bronchial tube, the lining, has, instead of the normal membrane like this, has inflamed lining. Also, the muscles, the smooth muscles that you see, brown stripes here, they go into spasm. So there are different medications for one, the inflammation in the lining, and two, these muscles tightening up. Also to remember that asthma can get exacerbated with the allergies, sinus condition, acid reflux, hiatal hernia and sleep apnea. Make sure it's not the dust mite, mold, grass, weeds, dog, cat or some food groups exacerbating your asthma. The first thing that I want to talk to you about is how to monitor your asthma. And this is a peak flow meter. This is what it looks like. Now, if you have asthma or high blood pressure, you would not take medications and not check your blood sugar or blood pressure. And this is what it is for asthma. You put this in mouth and blow out as hard as you can and record how far that red marker moves. And you write down, I could blow up to 500. If you can read that, that's my best number. When I'm feeling great, it's 500. If I'm feeling bad, it could be 300. And then you need to do something. You need to talk to me, call me, go to the ER, take your rescue medications, but you need to know your best peak flow number. If I see you in the office, I'll ask you what was your peak flow. What is your peak flow? And before we give you shot, we may also, in fact, we always check your peak flow. So make sure that you monitor your peak flow meter. Now we talked about spasm of the muscles. What takes care of that is this rescue inhaler. Starts working in 15 to 20 minutes. The effect wears out in 4 to 6 hours. The correct way of using this rescue inhaler, the Proventil HFA or Albuterol HFA or Ventolin HFA or ProAir, is one, to shake it. And you can use it straight in the mouth like this. But what I prefer is using a spacer device. This is what it is. A tube that goes between your mouth and the inhaler. So what you do is you shake and you put the inhaler like that, and then put this in your mouth and squeeze and hold. That's one puff. Then you shake it again, squeeze, that's 2 puffs, and you can do it up to 4 times a day or sometimes every 4 hours. But if you use this spacer, 50% more medication reaches your lungs. So if you don't use spacer, you would lose. That takes care of the spasm of the muscle. What takes care of the inflammation in the lining is a steroid inhaler. This is one of them. Asthma-Nex, Arobate, Asthma-Cort, Pulmicort. They all do similar thing. How to use this pink Asthma-Nex inhaler is you twist it open, put in your mouth and hold, then out. This is usually taken 1 puff twice a day. You put it in, you twist it close, and that's the Asthma next. Steroid inhaler, which takes care of the inflammation in the lining of the bronchial tubes. Some of you may have seen this Advair discussed. Advair has a steroid inhaler in it, which takes care of the inflammation, and Steroids, which is a long-acting beta agonist, which opens up the bronchial tubes, keep them open for 12 hours. This is what Advair discus looks like. You put your thumb here, open it like this, then you click it, and then you put this, hold, breathe out. You may want to rinse your mouth after you use Advair, because sometimes it can cause hoarseness of voice. And then you put your thumb here, close it. Once again, put your thumb here, open it, click this thing, close. 1 puff twice a day is the usual dosage. Some of the asthma patients and lung patients might also be taking nebulizer treatment. Could be albuterol, could be Xopenex, could be Atrovent, and it usually looks something like this. You twist it open, put it in the nebulizer machine, turn the machine on, it makes mist out of it, and you inhale it until it runs out. You can do this 3-4 times a day. There are some other medications. This is the Xopenex I was telling you about.